For me at least, I've heard Tunde speak more and more about the situation in Nigeria and the complexities of delivering pediatric care, dealing with infectious disease, in light of forces like Boko Haram and bandit groups. I've learned a great deal. So thank you, Tunde. What I'd like to say to all of you who are with us right now online, um, I think that the main intention of hosting this live is essentially so that you can ask questions to our panelists. And beyond the questions that you are posing right now, part of what we'll get to as many as we can, but part of what you're telling us is what you want to understand with greater depth, because we do have these 2 hours together today, but we can also set up other panels and other sessions to speak more in depth about specific aspects that you're interested in. So please do enter into the question and answer chat the questions that you have. If you are open to saying who you are and where you're from, that's helpful for us to understand. But otherwise, just enter it anonymously. We'll get through as many as we can after the next two speakers, but we'll also track what you're interested in. That's really helpful for us. And with that, I would like to welcome Dr. Martha Solomon. Dr. Solomon is a pediatrician at the University of Gondar. She was involved in the Tigray war, and so she's going to be speaking to us today about what's happening in the Amhara region of Ethiopia. And as I've been working on this panel, one of the things that's really startled me is prior to beginning to engage here, I didn't understand the severity of the crisis currently unfolding in the Amhara region. She's leading and working at the largest referring hospital in the region. And Martha, we're absolutely thrilled to have you with us today, and we look forward to learning from you.
Thank you, Dr. Gibson, and all the CUGH CUGH members, all of you, all the participants. You are doing an incredible job. You are saving millions of lives. You are representing those innocent segments of the population. So I'm so honored to be part of this international panel, and thank you again. So I'm going to show you just a drop of information from ocean like a problem. There is, it's called, in Amharic, we call it Abay Mbachalfa. You know, Abay is in Nile River. That's a drop of water from Abay. Okay, let me share my screen here. I'm going to present it with the slides presentation. Okay. So what are children? As a pediatrician, I have seen children health challenges during conflict in Ethiopia, during Tigray war, and still an active war. I mean, conflict is going on in Amhara region, some part of Oromia, between Tigray and Afar. There's still some problem. So the most vulnerable group of the population will be affected by this war. Those are children. Who I am, I'm a pediatrician, as I say, with 6 years of experience. Ethiopia is a landlocked country and second most populous country in Africa after Nigeria. I'm presenting also my case after Nigeria. I think it's well organized. I attended medical school at University of Gondar Hospital, and both my undergraduate and postgraduate program. I have a PhD in epidemiology, and I served the institution as community engagement director. My objective of this presentation is I want to briefly discuss my observation about how children's health has been put at risk during conflict in Ethiopia, particularly in the Amhara region. And this represents my perspective as a pediatrician, not anyone else. And I'm not a member of any political party. To begin my presentation, we will see impact of conflict on children's health in Ethiopia. It severely affects vulnerable population, particularly children, pregnant mother, and lactating mother. In Ethiopia, ongoing instability has disrupted essential health services like vaccination services, routine health care services. As a result, children face increased risk of disease, specifically malnutrition, when I say disease, vaccine-preventable disease, and limited medical care. This observation highlights the urgent need of protect children who are living in conflict zones. As of 2025, as far as my knowledge, the primary conflict regions are Amhara, Tigray, the famous Tigray war, which kills millions of population, millions of population, yes, and Oromia and Afar. Some of the impacts to see those children living in Ethiopia are millions of children affected by displacement, food shortage, and collapse of essential services. Health facility in many conflict zones reported damaged, closed, and lack of supplies. UNICEF estimates millions of children require urgent humanitarian assistance in Ethiopia. Just to see some of the studies, there are many studies done. This is some of the studies. The effect of conflict on child and adolescent health in Amhara region. This is a cross-sectional study done and community-based study. 798 children aged less than 18 years were involved in this study, and more than 1/3 of children were displaced due to conflict, and 331, which is for nearly half of them, get disease, with the majority didn't receive treatment during conflicts, and more than 2/3 of they experienced violence of different types, and nearly half of them had acute malnutrition, and most of them had severe acute malnutrition. Another also study done in Tigray as well. This is also community-based. As a pediatrician, most of disease are vaccine preventable, and children under 1 didn't receive it. It was done community-based and done in thousands of children. It's also nearly 39% of infants receive no basic vaccine, 0 dose. And 61.3% of children under the age of 1 received at least only 1 vaccine. And about 61% children were affected by at least 1 childhood elements, where majority of them were from rural area, and mothers who didn't seek postnatal care also were responsible for more than 75% of reported childhood illnesses. So it's related. One of the impacts of the conflict that we have seen is displacement. Many families, millions, were forced to flee their homes, lose access to safe water, sanitation, shelter, routine health care. And there are IDP camps, specifically in Amhara region, in Gondar. There are 2 IDP camps where thousands of individuals are living in it. For example, in the city, there is around Azazo in Gondar city, there is 1 IDP camp. More than 3,000 individuals are accommodated in that IDP camps. So there is limited mobility, reduces health access to vaccination and treatment services. In conflict-affected Amhara, 34.6% of children reported displacement, for example. The forms and adverse effects of insecurity among internally displaced children in Ethiopia are many. Of this, they face many challenges related to poor socio-economic conditions that expose them from several insecurities and negatively affect their well-being. They reported inadequate access to clothing, shelter, clean water, sanitary facility, food, and inadequate health care due to financial barriers, lack of basic drugs like antibiotics, and quality of care as well. So they are facing many health challenges among internally displaced children. Malnutrition crisis and man-made famine, very common. And in conflict, obviously it worsens food insecurity and disrupts aid distribution as well. In affected Amhara districts, 41.2% of children ranging from 6 to 59 months were malnourished. Most of them had severe acute malnutrition. And majority, more than 2/3, didn't receive any treatment. So this is also a bar graph that shows pre-war and post-war comparison of child with acute malnutrition is tripled, as you see. Those are forms of malnutrition, severe acute, moderate, and global acute malnutrition, and they are tripled after war. The occurrence of disease resulting from conflict in Ethiopia, we have seen outbreak in Gondar, measles outbreak, cholera outbreak. Nearly 2,000 were suspected for having a cholera after the conflict. Also measles outbreak, very common, malaria also. So devastating increase in vaccine-preventable disease, specifically in northern part of Ethiopia and some part of Oromia as well. And chronic condition worsened during conflict in kids. Children on follow-up with diabetes, renal disease, asthma, they are facing more severe complications. For example, diabetes, they are facing diabetic ketoacidosis and unnecessary hospital stay due to restriction and unsafe land transport, increased risk of children contracting hospital-acquired infection and significant economical burden. 42% of children surveyed in Amhara, they experienced illness during conflict and didn't get a treatment. Fever, infection, diarrhea, also some of the mental health risks. Also that, yes, exposure to violence, family separation and displacement increases trauma and mental health risk. Some of the most common PTSD, even based on studies, anxiety, depression, and also this is a photograph taken from northern part of Ethiopia. This woman is grieving for her husband and kids. So this is very, very devastating. The conflict is having significant toll on young people's mental health based on this study as well. When compared to relatively unaffected regions like Addis and non-affected regions of Oromia, nearly half of them young people pilot in Amhara and a third of this living in Tigray reported symptoms of associated post-traumatic stress disorder. Gender-based violence and abuse, yes, weaponizing gender-based violence and sexual violence are very common among young girls and women, and girls migrate due to fear of this violence and weaponizing, forceful and abuse. Girls migrate to urban areas and become domestic workers. They become homemade, servants. So which predispose them for violence and abuse. This is also a study of girls and women who are undergone this sexual violence by using as a weapon for a war by military groups during conflict, and they were exposed to various forms of gender-based and sexual violence, psychological and social problems, complicated sexual and reproductive health, even ended up with disability. Health infrastructure destroyed. This is also an image taken from northern part of Ethiopia, from Tigray. Damage to health facilities and insecurity, block access to services, interruption in immunization, maternal and child health services, and treatment for chronic disease also there was a shortage. You can see the bullet holes. The other is educational disruption. Schools were destroyed, teachers were displaced, usually migrate to the cities, and loss of learning materials and safe learning spaces. Children, based on this report, children out of school due to conflict in Africa is very common. Those are the hotspots. In Ethiopia, around 9 million of children are out of school. They accounted around 80%. So what are long-term consequences? Stunting and developmental delay from chronic malnutrition, lost years of schooling, reduced future opportunity, obviously, and increased maternal and infant mortality. Call to action, way forward. We don't love AIDS, but we would like to kindly urge, since it is a temporary solution, we would like to kindly urge U.S. governors to reconsider stop or the cuts of USAID funding and other donations, because it's very important for temporary solution. And strengthening local child protection system, yes, this is very important. We have to, there should be international law that protect child should be enforced in conflict zones like ours, and partnership still we love partnership with schools, health centers, and community groups with international community to save millions of lives, and supporting caregivers with resource and training and coordinated efforts between the government, non-governmental organizations, international agencies. And I know there are many influential people here. So we are calling you to action. In conclusion, conflict severely harms children physically and mentally health in Ethiopia. Immediate action is critical to prevent long-term and irreversible effects. Specifically, we have to prioritize nutrition and vaccine and other protection and recovery system are essential. Children's well-being must remain at the center of humanitarian assistance in conflict zones like ours. So I will conclude my presentation by saying safeguarding the future, no matter where they are. And those are some of the references. አመሰግናለሁ. Thank you.